What are multifactorial disorders? Simply put, these are diseases or traits resulting from a complex interplay of genetic and environmental factors. Both genetic and environmental factors, unlike conditions determined by single gene, multifactorial disorders don't follow predictable pattern of inheritance. Think of them as a symphony where many necessary elements, gene and environment elements blend together to create the final tune, the disorder. What kind of factor contribute? Genetics, environment. Genetic, while not as straightforward as dominant and recessive inheritance, multifactorial disorders are still partially influenced by genes. Researchers are continually identify risk allele gene variant that increase susceptibility but don't guarantee the condition. The dose of the allele combined with other factors modulate risk. Environment. These encompass a broad range of influences, include diet, lifestyle habit, parental exposure, toxin, and even chance events. For example, smoking and obesity can exacerbate the risk of type 2 diabetes, multifactorial disorders. What kind of factors contribute? Genetics and environment. Genetic, while not as straightforward as dominant and recessive inheritance, multifactorial disorders are still partially influenced by genes. Researchers are continually identify risk alleles. This is the most common, making this problem. Gene variant that increase susceptibility but don't guarantee the condition. The dose of the allele combined with other factors modulate risk. Environment. This encompasses a broad range of influence with diet, what you are eating, lifestyle, your sleep, your sport habit, parental exposure, prenatal exposure, X-ray, you may be exposed to X-ray, toxins, even chance event, for example, smoking, obesity can exacerbate the risk type 2 diabetes, a multifactorial disorder. Example of multifactorial disorder: common cancer like breast, ovarian, prostate, chronic disease like heart disease, stroke, diabetes, psychiatric disorder like depression, schizophrenia, and bipolar disorder, birth defect like cleft lip and palate, neural tube defect. The challenge of studying multifactorial disorders, the intricate interplay of factors makes it difficult to pinpoint exact causes. Environmental exposure can vary widely, making it hard to establish clearly. Ethical consideration often limit research possibilities. Despite the challenge, research on multifactorial disorder is crucial for several reasons. Understanding the risk factor, identifying gene and environmental exposure that contribute to risk can help predict or prevent the onset of the disease. Developing targeted therapies, knowing the underlying mechanisms can guide the development of personalized medicine approach. Promoting preventive measures, public health initiative can target modifiable environment factor to reduce the overall risk.